Right, so I'm now recording. Right, well, I will let everybody in then.
It's funny. I'm fighting you with the mouse. I'm like a cat. I'm trying to.
I'm doing it as well.
I was doing it. I didn't even know I was doing it. That was weird.
How can you guys see my mouse moving around the screen?
Yeah.
Okay.
I was chasing.
Right, let me try that again then, because you shouldn't be able to see that, or
All right. Okay.
should just be the PowerPoint that you can see. Is that any better?
Yeah, with your mouse. Yeah.
Right. Okay.
Don't worry
Then,
about that. It's all right. Maybe when you continue to record it, it'll lose the.
yeah. So screen sharing, recording on. Right, I will let everybody in and then we'll get started. We're up to 19 in the waiting room. So that is
Okay.
real. Okay, hi everyone, and thanks for coming along tonight to the Careers in Nursing webinar. If I could just briefly remind you guys to keep your cameras and mic off as much as possible, just to help with the bandwidth on the call, because I've got quite a few people with us tonight. Any questions that you've got, if you could ask those via the chat box, we'll do our best to answer. We've got a really packed schedule. So any questions that we can't answer during the session tonight, you will receive a follow-up email just tackling those as well. So I'm going to hand over to Leon to just briefly run through the plan for this evening.
Brilliant. Thank you, Sarah. Good evening, everybody. My name's Leon Pietrzak, and I'm a Youth Development Manager for an organisation called Health Education England that sits within the NHS. I'm talking really fast because we have such a packed agenda over the next hour. And in terms, as you can see, there's a variety of nursing specialisms that we're going to showcase today. And this is obviously building on from the variety of other events and future events that we're organising. And as part of that is to become part of this family. And Sarah's already mentioned that she's recognised already. So it's great to see that you are consistently coming to each of these webinars and the events that we're organising. Thanks, Sarah. So straight back onto me. So as part and what I've just alluded to there in terms of that variety of speakers that we have, this is all part and parcel of our Northwest offer to you to support you on your journey towards your direction in terms of whichever roles or role that you're interested in terms of health and social care. And just in terms of this flyer alone, over the last 12 months, through virtual means, as I say, we've reached over 1,000 young people in terms of registrations, and then that's gone on to a variety of different virtual taster days or webinars such as this, where you have had the opportunity to develop your knowledge and understanding of the variety of roles in health and social care. And it's really, really key for us for you to understand the mechanisms in terms of the support that we're trying to put in place for you, or is in place for you. And the importance in terms of the pre-learning packs that we're providing you, because it has key information that will really, really help you with your personal statements, UCAS applications, apprenticeships, whatever route way you're going to look at. And we have a fantastic speaker following me. But that perspective in terms of that pre-learning, our post-learning, and these 1 hour webinars are all designed to give you that bit more knowledge and understanding, an opportunity to ask questions that you might not have thought of before, or you may be a bit worried to ask. And the idea of this is there's a safe space where you can ask a number of professionals those questions that you need to really think about in order for you to progress with whatever route way you're looking at. There are certificates of attendance available, and that is obviously done through Shaping Futures. And all we have to do there, Sarah will be in contact with an aftercare pack. And then if you do want one of those, she does work with the schools and colleges in order to assist you with that, to demonstrate that you have attended. The Creating Careers, this is one of many webinars that we've had. We've had an allied health professions one that followed up from our taster day in March. And then also from that perspective, we had a social care webinar, and now we're having a careers in nursing one. And then following that, we also have a non-clinical one next month, and then healthcare science. And the importance is each time, there's so many roles that interconnect and that are linking. It's really important for you to gain an understanding of all these variety of roles. Even if it's not a particular role that you're that interested in, it's great to get an understanding and an insight into someone else's job and how it might link to you in some way in the future. Share your journey with us. So over this one in the webinar and in the chat box, or over the next 12 months with Shaping Futures, if you can really share your journey with us, where you're at, what your barriers may be, and what support you may need, that's the idea of these webinars. And just to reiterate, we will always be here in terms of Health Education England to support you, Shaping Futures in terms of the one-to-one support and a variety of other ways that the Shaping Futures can support you, and then also the variety of other partners in terms of the Careers Hub and the Liverpool City region, in terms of Sharon, who will speak maybe a bit later, in terms of, you might hear her asking questions around how we can support you. But without further ado, Sarah, if you pass us on to the next speaker, because I'm conscious I'd like to invite Jackie. Jackie, could you take over from the routes into nursing, please? Thank you.
Yes, thanks, Leon. Just to introduce myself, my name's Jackie Gladwin, and I am the Widening Participation Vocational Learning Lead for Health Education England in the Northwest. I trained as an adult nurse and qualified as an adult nurse back in 1991, and have had quite a long career, both working clinically. So my background, I worked as an emergency care nurse for many years, and then went into education and managed nursing programs and was teaching nursing. And now I'm working much more strategically within Health Education England to ensure that we have a diverse workforce going forward within the NHS and health and social care. So I'm just going to give you a very brief overview of some of the different routes into nursing. So if you can put the next slide up for me. Okay, it's quite a busy slide, but basically gives you a good overview of the different types of routes that are available. It's not just via the traditional route through university. There's lots of other different routes dependent on where you come from and what qualifications you've got. So if you come in as somebody who perhaps has not been able to get employment, you could potentially become a member of staff through attending employability programs. So these are programs that are designed to prepare people for work, sort of extended work placements. And Prince's Trust is a good example of that. So for young people, Prince's Trust provide these kind of programs. There's also apprenticeships. So you can either come through the traditional route and go through the university as a fee-paying student, or you could, as an employee within a trust, be put onto a nursing degree apprenticeship. Work experience, obviously quite difficult at the moment, but we do offer virtual work experience type opportunities, and going forward, looking at work experience from the point of view of working alongside some patients. Now that can be anywhere, it doesn't necessarily have to be in a hospital setting. T-levels, some of you may have heard of those, new qualifications bit, similar to sort of BTEC qualifications that you'd be used to, but have a industry placement and much more work experience associated with them. And the health and health science T-levels start running from September this year. And there's several different routes within the health one, adult nursing being one of them.
I'm not seeing anybody.
If somebody's got their, it's not muted. Supported internships for 16 to 24-year-olds that have learning difficulties. We're about to start a programme, hopefully, with a company called Project Choice, who support particularly young people with learning difficulties and autism. And again, it's sort of a work-based programme. For those people who have been qualified in the past and have either retired or gone on to other careers, there's a return to practice route. There's traineeships, which again are programs for young people, which prepare them for work. And there's also the Kickstart scheme. So the Kickstart scheme is a sort of pre-apprenticeship scheme for young people to again prepare them for work. Sorry, that's the cat falling off the wardrobe. Next slide. Okay, so this essentially gives you some career pathways in terms of how you could get into nursing and what that career pathway may look like. So coming in as a level 3 student, as I said, usually on some kind of health and social care course, or having undertaken some A-levels, you might be part of a cadet programme. Many of the colleges run cadet programmes, and they will be going forward with the T-levels as well. So you may then get a job as a healthcare assistant and a junior healthcare assistant, which you'd have basic training, and that's an entry-level post, usually no or minimum experience. Progress on to be a senior healthcare assistant, obviously with a range of additional training, could work in a variety of different settings, primary care or acute care. From a registered associate, essentially able to work across different fields with level 5 apprenticeship or foundation degree, again working in primary or acute care settings. You then move on to be potentially a registered nurse, junior staff nurse, registered within specific field. So that could be mental health, adult, child or learning difficulties. And that's a degree level qualification. And as I said, that could be either as an apprentice or as a fee-paying student. Moving on to be a senior staff nurse or junior sister or charge nurse, or you could be a clinical educator. And again, you'd have specific post-registration qualifications and experience dependent on the area you're working in. So that could be primary care, might be working as a district nurse, for instance, or health visitor. Moving up the scale then to a sister or charge nurse, which basically would be a manager of a ward or a department, or again, a senior clinical educator at an organisational level. Progressing through to management, to be a senior nurse. Sorry, Leon just put something up that's right in the middle of the page. Senior nurse or a matron, so you could be manager of an actual service rather than just a ward, or again an education role. So like I did, went into a university as a lecturer and then advanced up through education to be a principal lecturer at a management level. And then moving on from that, there's advanced clinical roles or senior management roles. So there's a clear career pathway for nursing dependent. It doesn't matter which field you determine to go into. Career pathways are very similar. Sorry, Leon keeps putting messages up and I can't see the screen. I can't see the slide. Next slide, please. So just again to reiterate types of routes in really, and as I said, there are different routes dependent on what experience you have, what qualifications you have. So there's a traditional sort of A-level, level 3 qualification route with BTECs or MVQ or T-levels, going through to the undergraduate nursing degree, which is 3 years, or the degree apprenticeship, which is 3 to 4 years, depending on which programme you're doing. You could also be a trainee nurse assistant, associate assistant practitioner. That's a 2-year programme, level 4 and level 5 programme, or you could be a healthcare assistant full-time as employed, which from being a healthcare assistant, obviously you could go on to either being a nurse associate or a degree nurse. So looking at qualified nurse roles, again, as I said, if you're a trainee nurse associate or assistant practitioner, you can move through to become a degree nurse, a registered nurse, by doing a top-up programme, and essentially would get you to be a qualified nurse just over a longer period of time. If you've got no formal college qualifications, you would need to have at least English and maths at level 2. You could be a trainee healthcare assistant, do your functional skills as part of that, or do a Prince's Trust programme, again, doing your functional skills, move up to be assistant practitioner or nurse associate, and then essentially follow the route above, so that eventually you would end up as a qualified nurse. So there's a range of opportunities really, and so it doesn't necessarily mean that just because you don't have A levels, you can't be a nurse. Next slide. From point of view of being a dental nurse, dental nursing is essentially a separate field of nursing, and you don't need a degree to do that. We're just setting up a first apprenticeship dental nurse, which will be running across Greater Manchester as a pilot. Was due to be starting in September. It's been delayed slightly because there's been some changes at the dental school, but essentially we will be looking to recruit a cohort of around 20 dental students, and essentially it's a level 3 diploma, so very accessible. Okay, next slide. I think that's all mine. Oh, this is my career in pictures essentially. So on the left hand side you've got some examples of where nurses might work. So you know, nursing is not just about working in a hospital. You could be working in places even such as a cruise ship, for instance. Many of my colleagues in A&E went to work on cruise ships. You could be working in people's homes, care homes, could be in the military, could have a range of acute roles, so working like I did in emergency care, in theatres, or you could be working in general practice, working alongside GPs. You could be working in research or education, so a huge number of different roles. And employment sectors. You can even work in the insurance industry as a nurse. On the right hand side, as I said, that's my career essentially. From the left hand top corner, as me as a student nurse with my cohort, and my that I'm very proud of, that I was presented as a nurse from Manchester Royal Infirmary when I qualified. As a picture of us meeting the Queen. That's one of my highlights of my nursing career, meeting the Queen. And there's also a picture of me with an elephant, because that's what I would have done if I'd not been a nurse. I would have been an elephant keeper. Still time yet, eh, Leon?
Definitely, Jackie, yeah, but not for a few years yet. Not
for a few years yet, okay. And I think that's it. Is that all of me, Leon?
Yeah, brilliant. Yeah, it was just obviously to set us up from the adult nursing perspective, Jackie, really.
Yeah.
Just to obviously.
Oh yeah, you wanted me. I'll just give a quick. The main thing to say about adult nursing is it's the most flexible of the qualifications, because it doesn't pigeonhole you to work in one particular field. So if you do mental health or learning disability or child, you're limited to a certain extent as to where you can work and the groups you can work with. But adult nursing, you can work with mental health patients, you can work with people with learning difficulties, and you can work with children in some settings. So it's a much more generic qualification. And if you wanted to go and work on cruise ships and things like that, then that's the qualification that you would definitely need. Same length of duration as all the fields of nursing. So it takes 3 years through the normal route. It could take slightly longer if you're doing the apprenticeship. I would say it's, from my point of view, it's certainly a very flexible qualification and gives you a lot more opportunities to move around and experience different things. That's that.
Brilliant. Thanks very much, Jackie. As I say, this is very much a bite-sized session tonight. So if you have a number of questions, one, I'm scared to touch the chat box while Jackie's chatting. Two, we will get all your questions and so forth answered either via a sort of frequently asked questions sheet post this event also, but there is opportunity. Obviously, ask your questions in this chat box and we will do our utmost to answer them over the next 40 minutes. But thank you, Jackie. And then we're going to bring you straight on to, hopefully, Lynsey, if Lynsey is here. Sarah.
Hi everyone, I'm Lynsey. So I don't have a presentation. I think I've jumped in last minute. So my name's Lynsey Brown. I'm a learning disability nurse and I work for Merseycare. Not sure if any of you are familiar with learning disability nursing. Just to say, I do have to go straight after this, so if there's any questions, please just email them and I can answer them for you. So with regards to learning disabilities, there are 1.5 million people in the UK that have a learning disability, and a learning disability happens either...
You hear that?
Can you all hear me?
Can you hear that?
Ruth, sorry, could you turn your camera on your... Thank you very much. Sorry, Lynsey.
Okay, it's okay. So learning disability either happens before or during birth. People with learning disabilities are exposed to health conditions, social disadvantages, and they experience difficulties with social interaction and communication. So the main role of the learning disability nurse is to improve or maintain a person's physical and mental health, reduce barriers to people living an independent life, and supporting the person in living a fulfilling life. So where will you find learning disability nurses? Well, you can find them nearly everywhere, not on a cruise ship though. I'm not sure that there's any learning disability nurses that have gone to work on a cruise ship. I might be one of those if they were. But you will find us in people's homes, in education, hospitals, in community centres, community settings, prisons and mental health wards. So I was asked to just talk about my journey as a learning disability nurse. So I qualified in 2010. And before that, I was a support worker and I worked on a medium secure ward for people who have mental health and learning disabilities. So after qualifying, I went to work on the wards and I was there for 6 years, supporting people who were sectioned under the Mental Health Act. And that was a really rewarding job because these people had experienced difficulties in life and that brought them into trouble with the criminal justice system. And so they then came to be supported on the wards where we use interventions to help them with things like anger management or alcohol problems. And from there, we support them to go and live in the community and make sure they've got the correct package of care around them so that the risks are reduced and so that they can live a fulfilling life. After leaving the wards, I went to work for a team called the Specialist Support Team, and we cover Lancashire and South Cumbria, and there's also a team in Manchester. So we support people who have learning disabilities and either come into the contact with the criminal justice system or they present with behaviours that challenge. So our role is to work with providers of care, with families, with the individuals themselves to help them to reduce their own risks, to create better life opportunities for them, because people with learning disabilities are very much exposed to social isolation. There's a lack of employment and meaningful activity. And the main part of our role really is to advocate for that person and to help them live a fulfilling life. I've also spent time working in numerous prisons within the Northwest, including a placement at HMP Liverpool, where I set up a learning disability pathway so that people coming into the prison system with learning disabilities were able to serve the sentences safely and fairly. And that involved doing different things, including training the prison officers with regards to how best to communicate, because communication is a really big barrier for people with learning disabilities. And that's sometimes one of the things that can get people into trouble. For example, someone with a learning disability might have a really big problem with processing time. So an action might be asked of them, but they're not able to process what was asked straight away. And very often that can lead to difficulty in relationships because people think that that person's just ignoring them or they're not listening, whereas they're just really struggling to understand what's been said. So this week I've just started a new role, and I suppose this helps to show how diverse the role of the learning disability nurse can be. So I've just moved to go and work in Greater Manchester, where I'm going to be working for the Health and Justice Strategy. So I'll be working with the police, probation, social workers, local authority and health. And the aim of that strategy is to try and reduce offending but also to support the person through the criminal justice system, so that their journey is fair and equitable, and also so that we can put things in place so that person's role in life is more meaningful. So then, you know, they're not looking at criminality to try and find an escape from where they are, or to try and make up for the disadvantages that they've got. So that's a really exciting role. It'll see me working in the courts. So there's not much I can say about that role at the minute because I'm only just learning it myself. So yeah, that's a role of the learning disability nurse. I hope it's been helpful for you all. I know it's only a little snippet, and the learning disability nursing isn't something that everybody knows about either. It's not something that's always there on the map. We often get confused with mental health nurses. Although we work very closely with mental health nurses, we are two different kind of breeds of nursing. And that's that. So thank you for listening.
Wow, Lynsey, wow. It's kind of the last part of the aspect is my life is where that kind of started for the last 20 years of youth offending and working with young people that were victimized, you know, in terms of maybe having disability and so forth. And it's really, really interesting. And it's fantastic to see that the variety of roles can do and how it can adapt, you know, because as I say, I never thought about being a youth worker in the NHS. And now you're going the other way.
Yeah, absolutely. Absolutely. Yeah.
Brilliant. I can't see the chat, and I'm also scared if I answer anything that I cut you off. So I don't know if there are any questions or if any of our other professionals have any questions for Lynsey, but it's really, really beneficial. And I know, Lynsey, that Sharon, hopefully we've got you for half a day on the 6th of July to really give us that bit more in-depth aspect around learning disability nursing and the opportunities, and then to really explore that through that future event. But if any further questions come, I'm conscious of your time, but really thank you so much for making this time for us to see.
You're welcome. Okay.
Lynsey, thank you. Bye.
Bye-bye.
Brilliant. Lovely. Okay. Goodness me. This is a speed meet today, this. Could I invite Sarah from the Liverpool Women's Foundation Trust, please?
Hello, you okay?
Oh, there we go. This is like clockwork. I'm going to shut up.
It is.
Sarah, we've never met. Welcome to a crazy 1 hour session of the variety of different roles. And I'm going to be quiet now and listen intently to your journey, if that's okay.
Yeah, that's great. Thank you. Sorry, I haven't got a presentation. As I say, I've been on leave, so it's just a bit last minute for me as well. It's been really interesting hearing other people's perspectives and how our role as a midwife can kind of incorporate a lot of this, particularly with Lynsey's role as learning disability. So in midwifery, we come across all walks of life, all different problems people have, you know, regardless of what situations people are in, whether it's mental conditions, physical conditions. If they're pregnant and have a baby, we still care for them regardless. So with us, our paths entwine with everybody. So just a brief introduction about me. So I've been a midwife since 2014. I went into midwifery as direct entry. So there's different ways that you can go into midwifery. You can go into midwifery as a direct entry degree, which is a 3-year course, or you can do it as a transition from nursing also. A lot of the staff these days are coming over from nursing as well, because it enhances many opportunities that you can get when you become a midwife. Similar to earlier when they were saying about certain roles can kind of just put you in a place where you can't branch out much. Midwifery sometimes can be one of those areas because it's very specialised. So the more background knowledge that you can have, if you've got a nursing background, it opens up so many more doors as well. So I started working at Liverpool Women's Hospital, trained there and have stayed there. And very quickly I became involved in supporting students in their learning. And I've done it in many different roles. And now I'm actually in a role which is a practice educator facilitator. So whilst I still do shifts and work as a midwife, I support all students. So it's more of a management role that I've kind of come into. I look after midwifery students, nursing students, ODP, which is theatre students, paramedics and physios also. So I see a bit of a different branch with everything. Midwifery has been put across media so differently over the last few years when you think of some of the different programs that you've seen, particularly say One Born Every Minute. We kind of had an influx of everyone wanting to be a midwife at that point, but that is just a small snapshot of what midwifery is about. It's a big role, big part of somebody's life where you spend 9 months, working closely with them. And we're working towards a new model now where midwives are allocated to families from the beginning. And so they'll do that whole journey, getting to know the women, providing a continuity of care to improve outcomes for women. In terms of different roles that you can go into, like I said, we see a lot of women who have learning disabilities, mental health, substance abuse, safeguarding issues, bariatrics. So there's a lot of obesity at the moment. So we've got a lot of specialised clinics for these. We've got diabetic clinics. So there's so many different avenues that you can really go into. I'll come back to that question that's just popped up. So yeah, there's so many different things that you can go into. You can go into teaching, you can go into education within the trust, you can kind of form within neonatal. And it just, as your years and your experience grow, you develop different areas that you become more passionate about. So initially when I started, I never imagined I'd want to go into education, but I just find it really, really rewarding. As a midwife, your day-to-day is, depending on what department you're on, you can be working shift patterns, you can work Monday to Friday, you can work night shifts. So it's really different and flexible in terms of what people work. So one of the questions that popped up saying what's one of the hardest things, particularly if we're talking about how COVID has impacted it, it's the emotional side of everything. So the emotional side of midwifery at the minute, we haven't been able to have partners into the hospitals. It's been really, really difficult. And it's a case of, you're really challenging yourself as a person and developing a lot of skills, which before you even go to university, before you go to college, you've got a lot of these skills such as communication, which is so, so important. And no matter what you're applying for, these are transferable skills that you can do and carry over for applications. We do normally offer work experience. Obviously, because of COVID, it's something that we've had to stop. And normally when people come and have work experience, they spend time going amongst the wards, just getting to know different people that are there. Then obviously you can go the A-level option. There's people who can go into it later on in life, which is the access course, and that's a level 3 diploma. And that's the way I went into it. So I didn't go straight from college. I went to it later on in life and did an access course and then straight to university. And for me, that worked for me. Sorry, I'm just checking all these questions that are coming up.
I know you're too good. You're getting loads, Sarah.
So, I mean, in terms of the other disciplines, by all means, send any questions over by email and I can get back to you all, because obviously I'm aware this is just kind of midwifery specific. We're very unique at the Women's as we're a standalone maternity unit, and we're actually, although we're kind of out of Europe now, we're the biggest standalone maternity unit in Europe. So what we see coming through our doors, you don't see anywhere else. Our numbers of women, we have very complex care that gets transferred to us. We've got a high dependency neonatal unit, so we get transfers from all over the country. So it's a really good learning opportunity at the Liverpool Women's Hospital. Midwifery is a career that people go into and they stay into it till they retire. And it just shows, the passion and commitment that people have to the role. And also, you're working closely with families. And it is so rewarding to see coming out the other side, somebody going in as a couple and coming out as a family with a child. There's nothing more rewarding than that. Okay, I don't know if my time's nearly up, sorry.
No, it is, Sarah. One of the biggest questions we've got at the moment, I know it is around work experience, but for those students that are interested in midwifery, and obviously we can't do physical placements at this point in time, is there anything that you could advise them to? I mean, obviously it's fantastic doing sessions like this, add to their personal statements, but also the sort of virtual one-day events and any sort of virtual work experience. Is there anything you see in applications that might help them stand that bit further down the line? Or
yeah, so I mean, even like when I think back to when I applied for mine, there was even things where I spent time with Sure Start, with Home Start, different organisations that are working closely with families and kind of understanding the family dynamics. Obviously, we have a lot of safeguarding involvement and they are difficult to come across, but this is where Sure Start Home Start's really good. In terms of anything to do with breastfeeding, that's something that's really big. That will always kind of stand out on applications. At the Women's, you know, a lot of the trusts now are BFI accredited, which is a breastfeeding friendly initiative, and it's something the universities are accrediting, so they'll be looking for that also. Anything to do with, you know, demonstrating confidentiality, effective communication skills, and that's where I said before, it doesn't necessarily have to be something you've done specific, but it's demonstrating how you've got those transferable skills and how you can put them across. You know, the importance of good record keeping, good documentation, commitments, you know, wanting to develop yourself further. It's a role that you never stop learning in. There's always something completely different you'll see. So showing your dedication to learning as well, and attending sessions like these are all extra things that just make people stand out, you know, for extra commitment and the participation. I can always have a little think and put a little list together as well.
Yeah, great. And I'm just going to put you on the spot here, but and you are quite young anyway, but what advice would you give your younger self in terms of the career pathway, or anything you thought that you might have changed or might change?
Yeah, I mean, because I came into it when I was 25. So for me, I mean, I had children then as well. So my outlook was slightly different to how I think I would have been coming out of college, maybe straight away. And I think had I have come from college, there's the main emphasis, read so much as, you know, read as much as possible, really get to know with issues that are going on. There's so many things that are public health related that you don't realise are so relevant to midwifery. You know, we never would have thought COVID would have such an impact on midwifery, but it changed practice massively. So keep yourself aware of current issues that are happening. You know, look at transferable skills. If there's any study days of anything that you can think that would be of relevance, do it. Anything that you can really sell yourself, do it. Because at the minute, while everything's virtual, make the most of all these opportunities, because if things go back face to face, things aren't as accessible. And just, you know, kind of look at how different the role branches out into many different ways. Email people, ask questions. You know, no one's going to think badly for you send an email to inquire about the role or how things work. It just shows people's enthusiasm.
Sarah, there's a couple of questions in the chat. I know, Leon, I don't think you can see it, but just in terms of the length of time that it took you to become a midwife, how long was that? And can you, that's one question. And then the second question is, if you're on a standard nursing qualification, can you then move to midwifery?
Yeah, so the midwifery course is a 3-year course. So the access course that I did, that I mentioned, that was a year course. And then it was the 3 years at university. In terms of if you come into it through a nursing route, there used to be an 18-month conversion, but the conversion course has now changed to a master's conversion, and it is an 18-month programme. So it's obviously at a much higher level, but the employment opportunities are massive, and it's something the trusts are really looking for people who are dual trained as well, because we've got so many complex conditions coming through midwifery now. Having that nursing background really, really useful and important as well.
Fabulous, thank you.
Okay.
Amazing, thank you very much. Thanks, Sarah. Thank you very much. I look forward to working with you more as we go on. Thanks, Fiona. Thanks for that question. We're moving swiftly on, and I'm hoping, I'm not sure whether I've seen them or heard them yet, but are Liz or Chloe available?
Hi.
Yeah, oh, there we go.
I like the tag team, aren't we?
They're either a month early or they're
oh, we're not here at all.
I'm going to let you carry on. Welcome, you two.
Hi, sorry everyone, we've got to wear our masks because obviously because of social distance and stuff, and we're both on site today. So I'm Liz Grady.
And I'm Chloe Welsh.
And we're very similar to Sarah. We're both practice education facilitators here at Alderhay. But we thought we'd tell you a little bit about our journeys in regards to how we got to this point. So I'll start off with mine. So I've been qualified since 2002 as a paediatric nurse. My background was that as a young child, I had lots of contact with the hospital. And I do feel that certainly for paediatric nursing, most people tend to come with a story or a journey or life experiences that they've had. So I decided in school that I wanted to be a nurse, and I did health and social care NVQ as it was then. I did level 2 and level 3. So that gave me a really good grounding with regards to health and well-being, and generic information around nursing type things. I did some work experience. I emailed our local GP practice and was a bit annoying really, and knocked on their door a few times. And I used to go once a week to help them out. And when I say help them out, probably be a nuisance was the right word. So I used to help them with the prescriptions, put letters in envelopes, but I learned a lot of information from doing that. And I got a lot of skills from that. After that, I applied for my nursing and went to do a diploma in nursing, which doesn't exist anymore, but at the time that was the thing that people did. So I did a 3-year nursing diploma and then stepped onto the register as a surgical children's nurse here at Alderhay. Started here in September 2002. And then I went on and continued my training, because I think one of the big things with nursing is that your education doesn't ever stop. So every day we're learning new things, and it's about continuing your education. So I've gone from a diploma to a degree to a master's, and I've kind of just moved through with that. We support lots of university courses, and there's lots of places where you can do nursing. So University of Liverpool does do nursing, but they don't do paediatrics. And they tend to do just adults. For paediatric nursing, so children's nursing, and you are looking at Edge Hill or John Moores, they're our chosen providers. We also do use Chester University as well, although they tend to use a lot of placements towards the Wirral. So I've kind of moved my role. So I left the ward in 2008 and then came into a health promotion role where I supported families and young people with health promotion, and then moved into a practice education role. And I still do clinical. So I'm a gynecology nurse specialist here in Alderhay, specialising in gynecology for young people. So we'll working with colleagues over at Liverpool Women's, but being based here on site. But that enables me to keep my skills up and still use my nursing skills, but from a very different aspect. Chloe, your role's slightly different, your journey a little bit to mine.
So I come into nursing straight from college, so I knew throughout I wanted to become a children's nurse, so based my GCSEs and A-levels on what I wanted to do. Successful, got into university. I done a combined course, children's nursing and social work. We were the first cohort for that. So yeah, that was a 3-year course with both specialities and roles. Once I qualified, I worked on a surgical ward, and then from then I've kind of moved and done a little bit of anything and anything. So I've done, I've worked in A&E, I've worked in medical. My majority of times a qualified registered nurse has been in medical. And from there, again, as Liz was saying before, your education never stops. I've done modules back at university. I've done various courses to help me develop as well. These have helped me become a senior nurse on the ward. And from this, I got to do a Band 5 development acting in a Band 6 role, which I learned so much from. This led me into more of an education role on the ward, while doing half staff nurse, half educator. And then from there to have come to work as a practice education facilitator in the trust. Yeah.
And I think the biggest thing from our perspective as children's nurses, I think we're there at the very highs, but we're also there at the big lows as well. So I mention all the time that people will stop me in Asda and say, oh, you looked after my little one. And I'm like, oh, I don't remember. Because we look after so many different families. But when they're in the worst possible moment, you're the one at the end of the bed. You're the one that's there offering them support. And don't get me wrong, it's really hard on us as nurses. You know, we sometimes need support. We need to hold our hands up and say it's okay to not be okay at times. And even for our student nurses, I've been this afternoon and had conversations with them and gone, it's okay, it's fine, it's really difficult. Go and take some time, go and look after you, and then come back when you're feeling fit and healthy. And I think that's the good thing about the NHS. There's lots of support mechanisms out there for people who've got medical conditions or underlying things and they're worried, you know, so lots of people with dyslexia and thinking, can I get into nursing? Yes, you can, of course you can, but we can make adaptations for you in placement and in practice. I think for us at Alder Hey, we're quite unique with regards to our speciality. So we are, you know, one of the biggest hospitals. We're bigger than Great Ormond Street, aren't we? Yeah. We're massive. And actually you're going to see some of those specialities, but it's quite hard as well. We don't just deal with the child, we deal with the mum, the dad, the nan, the granddad. The dogs never really come in, but sometimes we get we get everybody.
I've had a turtle on the ward.
We've had turtles on the ward, yeah, where they've brought turtles in. But I think that's the thing. The child might be fine, but we're dealing with all the other aspects. You know, A&E at the minute, there could be a 6-hour wait, and you're offering support to those families when their child, their pride and joy, they just want you to fix them and make them better. But you've got 25 other people in front of them that are more sicker than their child, but they are going to be really irate and really upset, and you've got to keep you cool and offer that support to them.
I think that's where communication comes in as
Massively.
well, doesn't it? And that's something I think you learn from your training, and I don't think you ever stop learning. And there's things sometimes you do wrong, there's things you shouldn't say that have come out and you think, well, shouldn't have worded it quite like that, and I think you learn from it as well. And again, it goes on to people, sometimes them social cues as well, knowing when then, you know, the parents' anxieties are on the ceiling, is it the right time to go in the room and say what you need to say, or do you need to take a step back and let them, you know, feel that way? And sometimes that's the right thing to do as well.
And I think for us in Alder Hey, we've got lots of careers in nursing, but we've got lots of other careers as well. So we've got healthcare assistants. We work with the Princess Trust, and we've got an advert out at the moment for that. That's on our Twitter page, offering clinical placements. We've also got apprenticeships out at the moment that we're doing a 4-year nursing course, so a great entry and a roll on to nursing. We look after our healthcare assistants, so we're currently putting them all through their care certificate. And even people down to our domestics, we need people to clean our wards. We need people as porters to push our patients around the hospital, because we're all part of a jigsaw, and if one piece is missing, it just doesn't work. So I think there's lots and lots of different roles. We do have Alder Hey have a YouTube video that's called Careers Within the NHS, so you can Google that and see all the different aspects, from allied health professionals such as physios, OTs, dietitians, you know, nurses, porters, catering staff. Everybody plays a part, and everybody is as important as the next person. Have we got a load of questions, Leanne?
Fiona's popped up, so there's bound to be a question. We want you on every single event.
You're very passionate, both of you. It's lovely to hear. Just a couple of questions. First one from Abby. What are the specialisms once you've qualified as a children's nurse, i.e. critical care or orthopaedics?
Oh, wow. So we've got on our ward area for students and placement wise, we have 26 placement areas, which are all different specialities.
Wow, okay.
A lot more specialities on top of them. So for example, we have ICU for critical care, we've got HCU, we've got a burns unit, specialist burns, we've got a cardiac unit, we've got a neonatal unit, you name it, we've got it.
Cover everything.
And one final question, can you gain an extra qualification after doing a bachelor's in adult nursing to move towards paediatrics?
So to transfer over to paediatrics, you do need to do a conversion course over. We don't tend to get people that convert over because it's quite difficult. What we normally tend to get is people who are undertaking an adult nursing and halfway through might go, I'm not an adult nurse, I'm a peds nurse, and they will then move over in their training. But once you step onto that register, you then need to go back to almost the beginning to do paediatric nursing, because you've learned all the requirements of what's the perimeters for an adult, whereas we've got babies, 4-year-old, 6-year-old, 12-year-old, 18-year-old. So we need different parameters and lots of different set things. So there is new courses now which are joint. So they've got paramedic and child, or you've got child and mental health, or you've got child and learning disabilities. So you can do dual programs. So for those people who are sat on the fence a little bit and not sure, that's the way to go, definitely.
Yeah. Fabulous, thank you.
Thank you, you two. Just full of energy, and we're on the 6th of July, the next one for you. Right, lovely. Thank you, Liz. Thank you, Chloe. Okay, moving swiftly on. As I say, there's just so many fantastic people in health and social care, and we're finding them every week, and it's amazing. And now we have Sheree and Leanne, hopefully, that's going to tell us about their journey as mental health trainee nurses. So I'm hoping
Hey, Leanne, can you hear me okay?
Oh yeah, we're all good.
Oh, good. Well, to put us on last after all of them brilliant speakers, thank you so much for that. My journey's at its infancy because obviously me and Leanne are both student nurses. I'm just finishing my first year now. But prior to becoming a student nurse, my background was very diverse. I started out working as a support worker from 16, being a volunteer, working in day centres with people with disabilities, going to university and doing a degree in biology, and then deciding to work in finance for 10 years. And then from there, I think once I had my little lad, I decided I wanted a career change. And with the skills that I'd learned over the years, I decided that what could be transferred into a good job and what would I look to do for something that was a passion of mine. And I decided to go into nursing. So there's not a lot really I can sort of go into, no presentation, no long speech. But all I can say is that, you know, no matter what you decide to do during school, after school, what jobs you take part in order to sort of follow a career pathway in nursing, just always take those skill sets that you've learned and everything you've done, and everything can be transferable. I would just advise that, you know, if you do have a passion to become a nurse, especially in mental health like I am, what I decided to do was look into the certain areas of mental health that I wanted to go into. So I'm very passionate about forensic mental health. So I've now been given a bankroll working for the specialist secure and learning disability units up in Ashworth, Rowan House and Rathbone, so that I can get more of an insight into where my career might go once I finish my degree. So there is always avenues that you can sort of get practice in before you actually decide on what you want to do with your nursing career. So I just think my advice would be, get involved in as much as you can, volunteer for things. There's always people looking for ambassadors for charities within mental health services or anything out there really. I know Leanne will talk differently about what her interests are, but I just think, you know, whatever pathway you decide to go into, get some experience in it. You always have them skills that are transferable, and just do a little bit of research into where you want to go and what the skills that you need are for behind it really, and just follow it. I mean, because I didn't think, 20 years ago I was going to be a trainee nurse at 37, and yeah, here I am. Leanne?
I'm doing an absolutely amazing job. Thank you.
Thanks, Leon, for inviting us back anyway. We thought last time round we were just going, we don't know what we're doing. So my background was basically, I was a youth worker for probably about 20 odd years, and started to see that young people were more and more presenting with mental health issues. So I wanted to work with the whole person, the whole young person. So I thought I might as well go along and do mental health nursing. So I applied for it and got a place in John Moores University. And what I've learned so far is that, and I never knew this, but 1 in 4 people will experience a mental health condition or difficulty in their time of life. So it's across the board. Like, so we might work with people with anxiety or depression or experiencing low mood, but we're also, with regards to some of the placements that I've been working with very complex cases with people that are having episodes of psychosis or schizophrenia. I'm actually working, got my placement in a PICU at the moment, which is a psychiatric intensive care unit, and it's an amazing experience. I got chucked into the deep end, as we say, because it was my first placement, because last year I was on theory base because of COVID. We weren't allowed to go out for placement, so suddenly got chucked into the deep end of going into a ward, and this is a 12-bed ward. We have 12 patients, and basically they all range from all different issues or things that are affecting them at the moment, including learning disabilities as well. Because I know the lady that was talking about learning disabilities saying that, you know, our roles are very, very similar. We do very similar things, but we also take it in a different direction as well. I found it when I first walked onto the wards,
I was so scared. Even at the age of 41, I thought, what am I doing here? I didn't know what to expect as a student, but I've been so lucky with my assessors and my supervisors. They took me under their wing and showed me what kind of things that mental health nurses do. A typical day for a mental health nurse really ranges from so many different things. Like, we might be working with adult services, we might be working with children, we might be working with later life dementia care. It's all really, really different. So if you wanted a career where you worked across the lifespan, mental health nursing is ideal, really. And that's the good thing about me, because I want to actually specialize in children's mental health. But I don't think that without having the placements that I can go to where I can actually work with the rest of the lifespan, I don't think I would have understood mental health nursing at all. So please, if there's any advice I can give, is don't focus on just one age group. Come along and work with them all, because I think it really, really helps. I'm thinking, Leon, did you want us to talk about what kinds of services there are, or?
Yeah, it's just, I mean, obviously this is building on a number of the students have been on a variety of these sessions, and obviously hopefully heard from you and Sheree before. So yeah, it's just sort of giving that little bit more, go on,
just a little bit more information. Cool. So as mental health nurses, you either work in the community, or you might work in an inpatient hospital setting, or you might work in forensics. Forensics is generally prison settings, or more of the acute settings where it's a secured unit. But basically a lot of the time you will be spent working with on one-to-one basis with the patients. It might be a 10 to 12 week episode where you're working with them, helping them to get well, looking at recovery, looking at their own individual things, working with themselves, working with their families, and also working with other nurses as well. So you might work with learning disability, you might work with doctors, you might work with OTs, so occupational therapists. It's not just us as mental health nurses working with these patients. You're going to be working with a range of people. So I think communication, as everybody keeps saying, is so much a skill that you need as a mental health nurse, because sometimes you're that first protocol that a patient will come to, and you need to be able to assess them and to find out exactly what their needs are. So that's across the board with community, with inpatient, and with forensics. And the kinds of patients that I've seen so far are bipolar, schizophrenic. I've had a lot of patients with psychosis, but the one that has really, really shocked me is I've been working with a lot of patients with autism as well within the hospitals, because there is this gap between learning disability patients that are having mental health issues, and actually them coming into an inpatient as a mental health patient. So yeah, that's the one thing that's really shocked me. So you definitely need dual experiences with that. I'm trying to think what else to say, Leon. I'm a bit stuck today.
I think Leanne's it's fantastic, and just sort of one little bit of advice, because as a youth worker, you always have one little last saying. So
always
one piece of last bit of advice, because today,
read. Mine is read, because literally you need to. In university, right, you will find that as a student, you will come in and do a lecture, and the lecturer will say, could you do this, this, and this? And you'll go, I don't know what that is. And they're not going to tell you. You do need to learn to read, and you need to learn to teach yourself as well. That is my point for the day today.
Amazing. No, thank you so much. And next time, you two are going on first. All right.
Good, because then we won't feel so, because we're only students, so we're
I know, I put so much. I put even more pressure on you. I'm so sorry. But thank you so much. And
kicking me out of my spot, Leon.
What's that, Jackie? Sorry.
I said you're kicking me out of my spot. I'm not good enough to open the events anymore. Then.
Oh yes, sorry. No, just after Jackie, of course. Yeah, sorry. I nearly had a heart attack in the timetabling then, Jackie, when you pop back. Thanks, Leanne. Thank you, Sheree.
All right, no worries.
Without further ado, the main, or one of the people that have put all this together is shortly going to come on, because behind the scenes she does all the technical aspects. There's loads to get this on in terms of this webinar. So Sarah, if you could just quickly take us through the next couple of slides, because I'm conscious that I have, as always, ran over.
Yeah, absolutely, Leon. So hi guys, you will have seen me from emailing you. My name's Sarah. I look after the outreach hub at Shaping Futures. Some of you will have worked with us before. If you haven't, we're essentially a collaborative network of the universities and colleges in the region. If you are joining us from Manchester or Greater Manchester tonight, you have an equivalent organisation who will look after you. My colleague Naomi can't be here because she's getting a COVID vaccine, so we'll let her off. But basically, we ask you to come to these events because we think they're super useful for you in terms of making your choices, personal statement content, application content for your ultimate jobs or your CVs, apprenticeships, anything like that. So there are 2 more left. If you are thinking about any other careers in the NHS, there is one non-medical one that takes place in June and a healthcare science one, which takes place in July. And I'll resend you the link if you want to sign up for those, or if you have any friends that might want to sign up. We'll also send you out any relevant opportunities as we follow up from this. So you'll get an email from me either tonight or tomorrow, which will have the slides attached. It will have answers to any of the questions that we didn't manage to get to in the chat. It'll also have a short evaluation form, which we would be very grateful if you could complete. On the evaluation form, you will have the option to say if you would like a follow-up conversation. And that is basically if you want to talk about any of this anymore, you're not sure about anything, or you just want to chat through your options. You're maybe you're torn between the neonatal pediatric careers or an adult career, and you will receive one-to-one support from my team or the equivalent team in Greater Manchester. So please do just fill that in, and if you do want any help with anything, let us know. That's literally what we're here for. In terms of how that'll happen, if you are in the Liverpool City region, I'll contact you directly. If you're in Manchester, that contact will be made through your school. You will receive a document summarising your participation and a certificate. I know some of you guys use that as part of your health and social care portfolios if you're doing that. And we will also send out a post-event workbook. So you had the pre-work, and this is a follow-up. It's basically this lovely snake sort of looking thing, which was made by my colleague Leanne. And the idea of the workbook is that it encompasses all the careers that we've looked at, all the events we've previously done, and the ones we will do in future. And the idea is that it helps you to start reflecting, start thinking, get all the information about what you've done in one place. So we really do suggest it takes less than 5 minutes. It's really quick, but it is really useful. And particularly if you are thinking about an NHS career or studying an NHS subject at university, this kind of reflective thinking and getting down what you've done will come in really useful then as well. I also just want to highlight, and again, I will send this content out to you, so you don't need to remember everything I'm saying. But we at Shaping Futures and the Careers Hub, who have also run this event with us, we have funded access to something called the Pay Index for you. This is a website, every single student can have access to it, and it will basically give you information on careers, wages, apprenticeship options, loads of different things. So I will send you the link and a little flyer explaining how to use it. And again, if you would like someone to sit down and talk you through it in more depth, please do just let me know. And that is pretty much everything from me. I've noticed there's lots in the chat box. I'm just going to have a quick look if there's anything that I need to answer. No, I think I'm good. So thank you so much for coming. Thank you so much for all of our wonderful speakers. And yeah, we'll hopefully see you at future events that we do as well. Brill. Thank you guys. Oh, and if you do need me to confirm this with your school that you came because you left early or had permission to leave or anything, just drop me an email and I can do that for you. Thank you.
Thanks, Sarah. Thanks very much, everybody.